All right, in this lecture, we're going to review natural and built environments and the implications that they have for health and health promotion. And we're specifically going to talk a little bit about the implications that leisure has for these topics. So, not only living and work, but also how leisure can be implemented or implicated in health and the effects that our environments have on our health. So I've broken this lecture down into two kind of sections. First, we'll talk about nature and natural environments, and then next we'll talk about built environments. So the way that we construct and plan our cities and towns and the implications that that has for health. Okay, so we're going to start with natural environments. When we think about nature or when we talk about nature, it's important to consider that for most of our human existence, we weren't as separated or lived most of our lives outside of nature, right? People evolved in nature and in natural environments and engaging with it in different ways. It's only kind of in these the last few hundred years of our existence that we've developed the trend of moving towards large cities and separating ourselves from nature and natural environments so drastically the way that we have. And nature is also really embedded in our ideas of recreation and leisure. So some of the earliest parks in urban spaces were called breathing spaces, and they were, places where people could go to connect with nature in the early days of the playground movement. We use terms like fresh air, so having fresh air programming or getting fresh air as something that's good for you. And we've seen that kind of popularization of terms like nature deficit disorder or claims that our removal from nature are the root of some of our different trends or kind of negative aspects of our current society. So it's pretty easy to see how nature is implicated in our health and the way we live our lives, and how exposure and being part of natural environments can have positive impacts on our health. But a lot of these claims, so for example, nature deficit disorder, aren't necessarily based on science or good science. So what's important to do is to, refer back to the literature, to the research, and see how we can explain some of these things. So there's a really good systematic review that looks at the outcomes of nature and natural environments and the physiological outcomes that they produce for our bodies. And what this literature review or systematic review identified is that there are both preventative and restorative effects on our bodies. So physiologically, being exposed to nature and natural environments has several impacts. So we have reduced salivary cortisol levels. It decreases our heart rate as well as our systolic and diastolic blood pressure, and it improves our immune function, which is measured through a variety of different markers. And all of these indications are physiological responses that indicate that being exposed to natural environments is actually inducing a process of relaxation. So it's not just a feeling, right? We don't just feel good, but there are actually biophysiological processes that happen when we're exposed to these natural environments, which are eliciting this feeling or giving us this feeling. And the systematic review also indicated or found some really interesting distinctions that we can make as well. So these outcomes are independent of the activity. So what that means is it doesn't matter what people were doing when they were exposed to nature or these natural environments, they experience the same outcomes. So whether you were sitting in a chair, just sitting in nature, or walking in nature, or playing in nature, these effects all were the same, essentially. They found that there were visual, olfactory, and tactile responses, or there were responses to those kinds of exposures, which means seeing nature, smelling nature, and feeling nature or natural objects all elicited these responses. And they found that different materials all produce these responses as well. So things like plants, flowers, woods, and oils. And what this showed was that it doesn't even necessarily need to be nature or not being out in nature to produce these responses, but working with natural products such as plants or woods could produce them as well. So you didn't necessarily need to be outside and in nature to have the positive effects of nature. So, for example, people doing activities with wooden objects experience some of these physiological responses, whereas people working with synthetic objects, so plastics or acrylics, didn't experience these same outcomes. So this might sound surprising, but we have a lot of things kind of built into the way we design cities or we live our lives already that should, that kind of actually reflect this. So when we look in different places, the article talks about the idea of forest bathing in Japan. So it is a practice. It is a common practice to go seek out natural environments and spend time in them. We know that there are many kind of instances where we use biophilic design elements in buildings. So things like green walls or wooden infrastructure in buildings, which are designed to bring natural environments inside built environments. We have extensive urban forest management plans where green spaces in cities are planned and managed to reach many people. And we have huge parks and recreation departments that manage trails and green spaces and protect these green spaces for us. So we do have a lot of infrastructure really to protect and promote these natural environments, which are often linked to ideas of health and well-being. So, to kind of bring this together, it's important to recognize that both active and passive exposure to nature, natural environments, and natural materials can have these positive outcomes. And we see this in some of the research, which has identified that people who live in close proximity to green spaces, so places like parks or conservation areas, um, have demonstrated to have increased longevity or better certain health outcomes. And it's important to recognize that nature and these natural materials are implicated in promoting health across different dimensions. So, physical, mental, social and emotional, and spiritual health through both preventative and restorative measures. So, by inducing relaxation and preventing the onset of some negative outcomes, and in a restorative way where we can use it to respond to some of these stresses as well. And one kind of final topic that I want to cover with regard to natural environments is this idea of green exercise. So, up until now, I've just talked about being exposed to natural environments or materials, but there's also kind of a body of literature out there looking at this idea of green exercise. And this links back really well with some of the discussions we've had about physical health and the other dimensions of health as well. So, green exercise is planned, purposeful physical activity that people engage in, at least in part, in natural environments. So, think instead of running on a treadmill, you go running in a park or running on a trail. And what the research around green exercise has found is that some of the same outcomes that we see from exposure to natural environments are actually enhanced by green exercise, or some of the outcomes that we would see from exercise alone are enhanced by doing it in natural environments. So, similarly, we see reduced blood pressure, heart rate, and blood glucose levels, reduced sympathetic nervous system activity, improve immune system functioning, and those markers of calming and relaxation are all reported in higher levels, reported or tracked in higher levels during green exercise. And then looking more longitudinally, sustained engagement in green exercise can be associated with reductions in mortality across a variety of different reasons. So, decreased mortality with regard to respiratory disease, cardiovascular disease, cancer, as well as mental health. So there are many kind of ways that nature and exercise in nature can be implicated in health and promoting health. But now I want to shift gears and talk instead about built environments. So not natural environments, not green spaces, but the way that we physically plan and construct our communities to provide opportunities for health promotion. So, what I'm going to review here is this idea of healthy community planning or planning communities for healthy communities. And it's important to note up front that these healthy communities don't just happen, right? They are not organic, they don't just spring up out of the sidewalk magically. Healthy communities are planned and prioritized and strategically envisioned around sets of principles which will promote healthy engagement in things like exercise or community building relationships, all these kind of things. And so the really helpful way to think about it is that health inequality is unavoidable. So there will be differences in health outcomes for different groups of people. But health inequities are differences in access and outcomes which are avoidable. So by planning communities with ideas of equity in mind and access, we can avoid some of these inequities and promote health more equitably for all members of the community. So when we talk about healthy built environment, there's a few different things that we can think about. So some neighborhood parameters or things to think about is a way we plan our land use. So what we use space for, how it is, how policy is made around land use in our communities. We can think about traffic and safety. So how people who are commuting or engaged in transportation of different modes can be safe no matter which mode they're taking. So walking, cycling, or motor vehicles. We can talk about crime-related safety or the kind of more social safety of a space. Talk about, as I alluded to, walking and cycling comfort. So in this image here, we see the lights are so far spaced out that at night there's long stretches of darkness that you would need to walk through. So that's not a well-planned space for someone walking at night. And we can talk about accessibility as well as aesthetics and upkeep. We can also talk about built factors. So those different factors that are built into our environments that can enhance or promote health or engaging with health promoting activities. So as I alluded to before, things like lighting and pavement, public transportation and access to that transportation, street connectivity, so the way that streets are planned and flow together so that they promote different types of transportation or accessibility of different spaces. So, when you think about a cul-de-sac neighborhood, those are much more difficult to commute two places in because there's no easy way to get anywhere, right? Lots of twists and turns and dead end streets. Whereas when streets are planned on a grid, you can always walk straight down the grid to get somewhere if you need to. We can think about housing density or the use of buildings. So, do we have exclusively industrial spaces, exclusively residential spaces, or do we have mixed use spaces where people can live and work and play all in the same places? We can think about how we manage traffic. So the measures that we take to calm traffic or remove traffic. We've seen recently with kind of the stay-at-home directives, we've seen many cities changing the use of their traffic spaces. So either opening up traffic space for restaurants or stores to use, or even shutting down roads completely and opening them up to pedestrians and cyclists to use when there's more people that need to get out and use those spaces. And then we can think about storage and parking. So this image here shows bike storage with a nice overhang there. Presumably this might be in a place that gets a lot of rain. In places with a lot of rain, it's often less comfortable to take your bike if your bike's going to get wet or going to get soaked during the day. So in these places, they've developed a variety of different tools such as these to protect bikes and encourage people to cycle in these spaces. And so, if you're interested in kind of a current example of this, you can look up the Young Tomorrow Project. So, this was a consultation that's ongoing, but was really picking up steam in 2019. And it's a plan to re envision Yonge Street in Toronto. So, there was a series of community consultations that was taking place where people could provide feedback and talk about what they would like to see for Yonge Street. So if you've ever walked the Yonge Street stretch between, kind of College and Queen Street, it's a little bit beat up. There's a lot going on there. It doesn't look the freshest, like it's the most recently spruced up neighborhood in Toronto. And so this project is about getting community engagement, getting people involved in the planning of that process, and re envisioning what that could look like. So here's just a couple examples I took from the website about the different options. So you'll see the top option here. They have, both of these options here are what they call car-free options. So it means removing the traffic from Yonge Street and offering different uses for that space. So at the top, we see pedestrians all the way through. We see where there's space for some green spaces or patios and storefronts on the outside. And on the bottom one, we see how there's integrated bike lanes. So what this would do would then make Yonge Street one of the main veins for cycle commuting down this strip, right? So very interesting the way that community members can be engaged and provide input in some of these parameters and built factors of these communities. So to get us thinking a little more broadly, I want to review what is called the Healthy Built Environment Framework. And now this is a planning framework for planners and policy people to use, which helps you think about the different aspects of the built environment that can be planned and purposefully engaged in a community for the purpose of promoting health. And this is based out of a research center in British Columbia. If you're interested in learning more about it, you can look up the Healthy Built Environment Framework and find all kinds of details on these tools and how you can use them. So the tool is based on the idea that roughly 10% of the impact on our health comes from our environment. So we see this breakdown here where it suggests that 10% of our health is determined by factors completely outside of us, so by our environment. So things like our air quality, the infrastructure in the communities that we live in, how we're able to engage with physical activity in those spaces. So that's a significant portion, right? When we're talking about 10% of our overall health and well-being. And it's things that, we are not able to control, but at the same time completely able to control, because if we advocate for and push for this stuff and we demand that our communities are built around these healthy built environment principles, we could improve substantially our quality of life and our health outcomes. So this tool defines a healthy community as one that's continually creating and improving physical and social environments and expanding community resources that enable people to mutually support each other in performing all functions of life in developing to their maximum potential. Right, so we see some important things here. One is continually creating and improving, so that this isn't a one-time static exercise, but something that needs to be engaged, re-engaged, and rethought continuously. And that there are both physical and social environments that can be built. And it's important to consider both the physical and the social when we're having these discussions. So, what is the built environment? The built environment is everything in our cities, in our towns, where we work, where we live, where we play, that has been constructed. There are many aspects of the built environment, and sometimes things that we might not even really think about. So, if you think about going for a run on the trails in the forest, you might not think of that as a built environment, but someone cleared that trail. Someone built that trail and put it in there. So that is part of the built environment. These are all implicated in different ways. And there's lots of different aspects of the built environment that we also may not consider. So things like air quality is affected by our built environment, right? We may not think of the air as being built, but the quality of the air is affected by how we build things around it. When we talk about housing, it's important to consider not just the houses that are there, but who has access to housing, who is supported in living in these communities and provided with housing that is affordable and accessible. We can think about things like injury prevention. So, are we effectively preventing people from injuring themselves in the spaces that we're in? Do we have safe crosswalks and barriers near bodies of water? All of these kind of things that can prevent injury. Are we providing equitable opportunities for different types of people to engage in our communities and to engage in health promoting behaviors in the communities? Are there opportunities for physical activity in different ways? Can people engage in active transportation to work? Does the infrastructure exist for people to safely and comfortably exercise in their environments, in their communities? And do people have access to food and food security in their communities? We've seen in previous lessons ideas of food deserts or food mirages. That is built as well, right? We construct the access that we have to food in different ways. So that is an important thing to consider. So here's some kind of cool illustrations that are taken from the Active Living Research organization at the University of California, San Diego. And some of this US data that they looked at suggested that people who live near trails are 50% more likely to meet physical activity guidelines based on where they live. That people who live in walkable neighborhoods are 2 times more likely to get as physical activity as those who don't. That teens who live in poor or mostly minority neighborhoods are 50% less likely to have a recreation facility near their home. And that the number of children who are physically active outside is 84% higher when schoolyards are kept open for public play. So these are some interesting statistics that get us thinking about the way that we build and maintain our environments can have an impact on how physically active people are able to be in their communities. Another important thing to consider is the role of transportation. And so here's some more stats on how transportation is such an important way of promoting physical activity. So people who live in neighborhoods with sidewalks on most of the streets are 47% more likely to be active at least 30 minutes a day. In Portland, Oregon, bicycle commuters ride 49% of their miles on roads with bike facilities, even though these are only 8% of the road miles. So by having the infrastructure there, people are drawn to that infrastructure and they use it. Median speed bumps and other traffic calming efforts can reduce the number of automobile crashes with pedestrian injuries by up to 15%. This speaks to a really kind of important issue in planning right now. There's the Vision Zero initiative, which they're implementing in many large urban centers, where the goal is to have 0 pedestrian fatalities on their city streets, and a lot of it is through traffic calming initiatives. And public transit users take 30% more steps per day than people who rely on cars. So yeah, lots of different ways that we don't maybe think about it, but the way we plan and manage our transportation can have really important outcomes on the or implications for how much physical activity we get. So now let's get into this tool a little bit more explicitly. The tool has these 5 physical features, or it's based around these 5 physical features of a healthy built environment. So what I'm going to do is take us through each of these physical features and talk about the planning principles that we can think about within these physical features. So what we need to try to do within these features in order to build healthier environments. The first is healthy neighborhood design. And the 5 planning principles for healthy neighborhood design are enhancing neighborhood walkability, creating mixed land use, building complete and compact neighborhoods, enhancing connectivity with efficient and safe networks, and prioritizing new developments within or beside existing communities. So, this is all about the different ways that we can shape neighborhoods and make them healthy places to live. And a lot of these are based on bringing people together, right? On the more social aspects of the built environments and the way we can bring people into space and share them together. The second is healthy transportation networks. So, transportation is essentially the way that we travel from place to place and get through the world in our daily life. And as I mentioned before, they have some really important implications for health. So, the planning principles under the healthy transportation networks is enabling mobility for all ages and abilities, making active transportation convenient and safe, prioritizing safety, encouraging the use of public transit, and enable attractive road, rail, and waterway networks. So, a lot of these principles here speak to the idea of access and enhancing access and equitable access to transportation and a variety of types of transportation, and really reinvesting in the idea of public transportation and moving away from personal use cars or vehicles and towards shared space and public transportation. The next is healthy natural environments. And this speaks to some of the stuff we were talking before about nature and natural environments and how these can have implications for our health. The 5 planning principles for this feature are preserving and connecting open green spaces and environmentally sensitive areas, maximizing opportunities to access and engage with the natural environment, reducing urban air pollution, mitigating urban heat island effects, and expanding natural elements across the landscape. So, some interesting ways for thinking about how we can not only just have green spaces, but how we can enhance the way these green spaces can be planned and implemented in our communities. Next, we have healthy food systems. So, thinking more now about how we can build or construct the systems to get people food and get people adequate nutrition. So, the planning principles for this feature are enhancing agricultural capacity, increasing access to healthy foods in all neighborhoods, and improving community scale food infrastructure and services. So here we see the real focus on the local, right? So on shortening supply chains for foods and bringing access to foods back into communities. The closer we can bring food production into communities, the easier and more accessible it is for people to access food in their communities and access healthy, nutritious food. And finally, we have healthy housing. So the planning principles for healthy housing are increasing access to affordable housing through provision of diverse housing forms and tenure types, ensuring adequate housing quality for all segments of society, prioritizing housing for homeless, elderly, low-income groups, and people with disabilities, and siting and zoning housing developments to minimize exposure to environmental hazards. So again, really seeing how these ideas of equity and equitable access can be embedded in the planning process and providing housing and appropriate housing for all people in a community. So now that we've reviewed these different features and the planning principles under each, I'm just going to take a minute to explain how they would work or how they are expected to work in practice. So essentially, for each planning principle, they are designed in a way that would have both intermediate impact, so a more short-term impact, and then a long-term health-related outcome. So the example here is enhancing neighborhood walkability. So walkable neighborhoods are characterized by residential density, increased mixed land use, and high connectivity. So as I was saying before, streets that come together, that connect, that people are easily able to commute down and find their ways around. The intermediate impact of neighborhood walkability is increased cycling, walking, and overall physical activity. When people are able to walk places, they do walk places. When it's easy to do that, they get higher levels of physical activity, and they're more likely to get that physical activity or their daily physical activity. The more long-term health-related outcomes of this are decreased obesity, right? So higher levels of physical activity, greater levels of fitness, decreased obesity, and also greater employment productivity. So when it's easy for people to commute, when it's easy for people to walk and commute or actively transport, they spend less time commuting, less time in transportation, more time with their families, more time being productive at work, and have easier access to other things that they may need to access around those times. So, in a highly walkable neighborhood, it's also easy for you to walk to the dentist after work and not have to spend 30 minutes commuting somewhere and 30 minutes commuting back and not losing that time doing something else that you were doing. So, the, I guess, kind of opposite of this is the cul de sac suburb neighborhood where everything is a drive away, where communities are sprawling and getting bigger and it's all residential and people aren't able to walk to the things that they need to do. So to bring this all together, thanks for bearing with me for this kind of longer lecture. Natural environments have several different effects on our bodies. There are definitely measurable physiological outcomes that natural materials and environments have on our bodies, which are important and can be used to promote health or enhance health. Healthy built environments are planned and prioritized, they don't just happen, and they're planned around the idea of promoting health and health equity. The various design principles that we saw can be implemented in order to enhance health for all citizens in a community. But again, these need to be strategically pursued and enacted in these communities and in planning. And I just will leave on the note that you don't have to be a planner to be advocating for these things, right? As a member of your community, as someone who resides there, you can have a say, you can advocate for some of these planning principles. And when you see communities hosting consultations or planning for new developments or planning new parts of a town or region or neighborhood, you need to get involved, right? You need to get involved and advocate for these principles, which will lead to greater, healthier, more equitable communities. So get out there, participate in your communities, and advocate for healthy built environments and natural environments in your communities.